To splint a suspected forearm fracture, it is important not to move the athlete until they are splinted. The first step is to decide whether or not to contact emergency personnel. The first step is to cover the ends of the exposed bones, if there are any, with sterilized gauze. If there aren't any, like in this case there probably would not be, you can splint the injury with bulky materials that do not have to be anything special, such as tongue depressors, cardboard, bats, magazines, blankets or pillows, or anything that will keep it firm. Here's an example of how to do so.
Tissue.
Next, you pull it across the body and find a sling. I will now be applying compression wrap to a swollen or injured ankle. First, you start with an ACE bandage that stretches, and then you start by wrapping the bandage around the foot. Next, you will pull up, hold it here, and bring it across the ankle, around, and back down around the ankle, up around the other side, hold it, around, and down the other side. You'll continue to do this motion until the ACE bandage runs out, and it is important to not make the wrap too tight. Otherwise, you can make the swelling worse. Once the ACE bandage runs out, you can clip or tape, like so. And can you feel that?
Mm-hmm.
Okay, and that is how you wrap an ankle. Next, I will show you how to control moderate to severe bleeding. The first step is to put on safety gloves so the transfer of the blood does not make it to the contact of your skin. Next, you will take a sterile cloth or dressing from a first aid kit and apply pressure to the wound. If this does not stop the bleeding, then the next step is to raise the hand above the person's head or heart, applying a fair amount of pressure to stop the bleeding. After the bleeding slows a little bit or comes to a complete stop, the next step is to grab some sort of elastic or wrap to help hold the dressing in place. While wrapping, it is important to keep the pressure on the wound. Once you have it wrapped, it is advised to keep the pressure on until emergency personnel arrives to give the victim stitches or a suture. To move an unresponsive athlete from a dangerous location, the one-person drag can be put into place. Put the athlete's head between your forearms and put your hands underneath their armpits. Slightly bend your legs and straighten them to not hurt your back and drag them to a safe location. To turn over an unresponsive or responsive athlete, you can use a 4 or 5 person rescue. This is normally done when the athlete is originally face down and must be moved to a place on a board. This method is used for an athlete who is unconscious and face down. The person that knows how to use the 4 or 5 person carry should be holding the head of the athlete. As we lift, she will keep the head stable. We will lift her onto the board. Next, 4 or 5 people will assist carry the board into the ambulance. The one-person walking assist can be done by yourself for an athlete that is slightly injured and can still walk.
Oh, yes. You can walk.
The two-person walking assist is for a responsive athlete that can walk but may have a sprained ankle or a slight injury to the leg, so they need support on both sides. You can use 2 people for the walking assist. For a responsive athlete that is unable to walk, you can do the 4-handed carrying assist. This is done by 2 people linking arms in a specific way to carry the athlete off the field.